I do want to note that hospital capacity and the data that is included in the dashboard includes the following: the number of acute hospital beds that are available, the number of intensive care unit beds, the number of ventilators, and surge beds. And with respect to surge beds, we want you to know that surge beds are the additional beds that are not normally used in the hospital system, but that are actually, that may be needed in light of this event of COVID-19. And just for the public, we want you to know that as of March 31st, there were 936 available acute hospital beds in the county. There were 92 ICU volume for COVID-19 in the county of Santa Clara. Laboratory testing for this virus is provided by commercial laboratories, by academic laboratories, and the public health laboratory. The public health laboratory is the sentinel and bridging laboratory in this kind of an emergency. The testing capacity in this county becomes more widely available depending on the ability of these players to provide more testing. The capacity is thus dependent on the ability of commercial and academic laboratories to grow their capacity rapidly. Lastly, as of April 1st, there were 8,246 residents of Santa Clara County that were tested for the virus. 956 residents of those tests were positive. 11.59% thus of those tested positive. So with that, I'm going to turn it over to Dr. Tong, who has been leading with her team the effort to get ready when it comes to capacity in our hospital system. Dr. Tong.
Good morning. My name is Dr. Jennifer Tong. I am the Director of the Healthcare Surge Capacity Planning Branch of the County of Santa Clara Emergency Operations Center. We have a team of almost 50 people who are dedicated full-time, working 7 days a week to strengthen the preparedness of our county to manage an increase in the volume of hospitalized patients and otherwise patients who need medical care. We are collaborating with each hospital in our county, focusing on multiple areas, but there are three of which that I want to speak about today. First, personal protective equipment, or PPE. It is crucial that every person who's taking care of patients in our community has access to the supplies and equipment that they need to stay healthy, because their ability to continue working is one of the most important parts of our surge capacity planning. We are working hard to understand what volume of patients we might need to prepare for and what volume of personal protective equipment that we need to prepare for. Likewise, we're working hard to understand the inventory across our county of such equipment. Our next task after that is to try to close that gap between what we anticipate we might need and what is currently available. Due to the worldwide demand for these items, we are focused on local expertise and supplies to help close that gap. The second key item that we're working on is bed capacity. Each hospital in our county is adding additional beds and, in many cases, entire units to help care for an increased number of hospitalized patients. We are all collaborating to identify the equipment, supplies, medications that we all need to prepare for to take care of such an increase in volume. We're adding 250 beds at the Santa Clara Convention Center. Those beds will be primarily for patients who have been hospitalized, all of whom will be COVID positive, and who need a safe place to go after the time of discharge. We are also working on increasing available beds in our county for patients who have skilled nursing needs. That means they might have been in the hospital, are no longer sick enough to require hospitalization, but continue to need enough nursing care that they are unable to go home or to any other independent living. Our third area of focus is around staffing. With that increase in bed capacity that I just described, our staffing needs change dramatically. Each hospital is working on plans how they can creatively restructure care teams to incorporate volunteers from the community. They're also working on ways to expedite hiring practices to bring in new staff to their care teams. Within the next couple of days, we will be releasing an online intake form for those in our community to express their interest and experience and expertise to contribute to the care of patients throughout our continuum of care. Finally, we would like to thank all of our people in our community who are taking care of patients. We would like to thank all of our hospitals for collaborating with us, the multiple elected officials, government entities, and industries. The collaboration of all of these different individuals and groups are what will strengthen our preparedness for a potential surge in our patient volumes. Thank you.